Hi guys, how's everyone doing today? Welcome to our live today. Here we have Dr. Gurani today. How are
Hi.
you guys doing?
Good morning. How's everybody doing? Happy to host a new live. It's Friday. Let's get ready for the weekend. But before we go home, let's have some questions. Please ask me something new that I haven't answered before. If you have questions that you've asked before and you want me to repeat them, concepts that you want to solidify, things that you're not sure about, please feel free to go ahead. We have about a good 25-30 minutes to do as much as we can to give you guys a nice look into our practice and my thought process on how I view plastic surgery and body contouring. So go ahead, please start reading the questions for me.
We are gonna start right away. Can breast reduction relieve tension headaches and neck pain?
Okay, tension headaches. I'm not going to comment on that because there's many factors that can cause tension headaches, stress of work, But neck pain has been associated with very large breasts. The weight of the breast pulls on the shoulders. You have to wear a large bra. The straps of the bra cause grooves, and it affects your posture. Yeah, so that can cause neck pain, and it might be associated with tension headaches. But yes, a very big breast is not comfortable for a lady, and reducing them is something that I really like to do. Restore them to a shape that's not too small. It's not about removing them. It's about reshaping them into something that's attractive, but yet manageable and can match the rest of your body.
Of course. So here we have a question from T Does It Better. Welcome, love. How are you doing today? Do you do round 2? I ended up having a BBL back in October.
Okay, yes, I do round 2s. I do round 2s on patients for many reasons. Somebody else they went somewhere else and they're not happy completely. They might have a good result, but they want more. I do BBLs for my own patients because remember, guys, this is not a cookie cutter. Not everybody has the same type of skin. Not everybody has the same space under the skin for fat accommodation. Everybody has a different issue that some people need more projection. The skin doesn't give them that projection. Some people want more hips. So anyway, for a variety of reasons, the patients might need a round 2. So yes, I do round 2s. I have a little disclaimer that I will evaluate every single patient separately. I will look at your pictures, look at your history, and give you my advice based on what I see on a picture or in person here, and when I see you for clinical examination, what I think is the next safe step to take. So you might be thinking of a BBL or a Lipo, and I might give you some pointers, and so please take advantage of my experience, my knowledge base, my fund of knowledge, and my experience of doing so many of these procedures, where I've seen different patterns, become more obvious, and I try to see if I can base a lot of my experience so that I can benefit the future patients.
Of course. So we have another question here from Adrienne. Does he do ultrasound with BBL?
Okay, guys, for the 1 millionth time, I use the ultrasound while I'm injecting. It's a tool that I have added to my armamentarium. I use a bimanual technique. I inject with one hand. I have the hand that's not injecting on the patient. I can feel where the man cannula is. I can feel muscle contractions. I can feel where I am in the level. This is called proprioception and knowledge of anatomy. And then on top of that, I have an assistant holding the ultrasound, and I have an iPad that has the image in front of me so that I can confirm what I'm feeling on the screen. So yes, I use the ultrasound.
We have a comment here. Dr. Gurani's bedside manner is 10 out of 10. He was honest and knowledgeable. Trust his recommendations.
Thank you, I appreciate that. I try my best to be as honest as possible. Sometimes it sounds blunt, sometimes it doesn't come across as smooth as I would want it or I'm thinking it, but I'm involved in my thought process. I get very passionate about what I do, and I try to give you guys the best that I can every moment. it doesn't matter who you are or where you come from, and any other variables, it doesn't matter. You're going to get the best that my conscience drives me to give you.
Amazing. Why is it important to stop smoking and to stop drinking before surgery?
Okay, so smoking is easy. Smoking has a lot of additives that are poisonous and can affect your healing. And the other thing is, very important, is it causes the vessels that deliver oxygen to the tissue to be tighter, and it also takes away from the richness of oxygen in your blood. I don't want to get physiologically too technical, but oxygen delivery is important to heal, and nicotine in your blood works against that and makes your vessels tight. So if you're not getting blood supply to the area that we worked on, then it's not going to heal. You're going to get infections, dead skin, and that's not smart. So please stop smoking at least 3 weeks. And don't forget, if you have a partner that smokes or uses any type of tobacco, including vaping or hookah and all that stuff, the different varieties, please stay away from them. So I know your family member might smoke, so please ask them to smoke away from you. Stay away from them. If you're in a job that there's a lot of smoke allowed in the nightclub or a bar. Again, take a break from it or wear a mask or something like that. So, drinking. Okay, alcohol is a very taxing substance on the liver and on your body, and it basically turns into formaldehyde after the liver gets done processing. So basically, it is like a preservative, and it is definitely going to make your blood thin. You can bleed more, and metabolically, it's really taxing your system. And I need you to be in the best shape possible so that you can endure and tolerate this procedure, whether it is a lipo or a BBL with a lipo or a tummy tuck or whatever it is, to have your liver in the best shape possible to continue producing the proteins and the amino acids that you need so that you can make the building blocks of tissue that you need for healing eventually. All right.
Will my breast shape change after weight loss post-reduction?
Yeah, it will. You will lose the breast tissue of a human being is made out of the tissue that makes milk and also fat. When we gain weight, the fat component of the breast gains weight with us. So if you come to me and I perform a breast reduction and give you a nice breast, when you lose weight, it will deflate. Obviously, you will lose weight from everywhere and you will lose weight from the breast. It doesn't necessarily mean that it is going to deflate completely, but yes, you will lose weight in your breast. So if you want to consider losing weight before you attempt any body contouring procedure, get to a stable weight, then fine, I think it's not a bad idea. And then come and get your tummy tuck, your lipo, your breast reduction, breast lift.
When having a breast augmentation, what is drop and fluff, and how long does it take?
About a month. When you put a foreign object under the skin, so the implant, foreign object, that's biocompatible with our body, that means our body accepts it. It doesn't matter where you place it, above the muscle, below the muscle, whatever. That skin is very tense, it's very tight because it hasn't had that, especially the younger you are. You haven't had pregnancies, you haven't breastfed, so the tissue is really tight. It hasn't had any reason to stretch so much other than puberty, for example. So all of a sudden you have a foreign body on there of a certain amount of volume that can range anywhere from 250 all the way to 500 depending on your body. That skin is going to be tight. And then as the skin relaxes, that means when the skin stretches, that means the skin is growing. More cells are being developed. And so in about a month, you will feel it becomes softer and it will drop a bit and it'll become a little bit more natural looking.
Nice. Okay, so the next question we have is, how do surgeons determine implant profile, moderate versus high?
Okay, it is, you measure the patient from the sternal notch to the nipples, the nipple to the fold, which is the fold under the breast, and you determine how much the patient has in terms of breast tissue, so how much their contributing from their breast tissue, and then where they want to be. Theoretically, you try to see where the patient's desires are, what they're asking for. They will show you pictures sometimes. They will tell you about a size. They'll tell you, I want the full C, I want the D, so on and so forth. And a lot of these numbers or these concepts are arbitrary because there's no standard for cup sizes. But nevertheless, it comes from experience, first of all, so that's kind of hard to explain. I've seen so much, and I have the experience with different tissue types, pre-pregnancy, post-pregnancy, post-puberty, and all that stuff. So with the patient's imagination and what they're seeing in their mind's eye, and with my experience, I try to get to a common ground. Try to get rid of some myths that they might have accumulated by reading online. You know, some patients come in with a volume, so they're psychologically, driven by a number. And I try to explain to them that, we can have two implants of the same volume, so the same number of cc's, let's say 400 for just simplicity, but they have different heights and different base widths. So a very important number for me is to see how wide is the base of your breast, so that we don't have a lot of side boob and then you're uncomfortable just in your activities of daily living. We don't want the implants to be so close that the cleavage is ruined. So it's very important that the implant sits with the nipple right on top of the implant, so it looks as natural as possible, as real as possible.
Of course. We have NY Cinderella. She says, love you.
Thank you.
And then we have Kennedy that says, see you Tuesday. Any tips on what I should do this weekend before my lipo/BBL? I'm nervous, LOL.
Okay, very easy. We'll see you Tuesday. Happy to help you. Relax a lot this weekend. Get in a lot of sleep. Hydrate very well. Stay away from any type of alcohol and tobacco, like I said earlier in this conversation. Definitely hydration, good food, a lot of, I would stay away from greasy foods. Basically try to, stick to more natural sources, fruits, vegetables, and a lot of hydration. And you know what? Do something fun, relax, try to be positive. I don't think that you should really do anything other than, really try to get a lot of sleep and eat healthy, drink a lot of fluids, stay away from smoking. I'm repeating myself, but that's really big deal. It's not a free-for-all. Okay, it's my last weekend before I get surgery, so I'm gonna not be able to party for another month. So let me go get it out of my system. That's not a smart idea. You wanna respect your body and treat it well, rest it so that you can be ready for surgery on Tuesday.
Of course. So we have Alchemist0613 asking, can you take off fat from excess skin in the arms and put them into the breast?
Okay, so this whole concept of removing fat from the arm is not a problem. If you have appropriate amount of fat that is bothering you in the arm and it's not just extra skin, then yes, you might be appropriate. Obviously, it's based on my exam of your examination of your pictures or seeing you clinically in person. Now, the concept of transferring fat to the breast, I do not do primary augmentations with fat. I know other surgeons around the country do that. I'm not a very big fan. I think implants look better. That's my personal opinion. And it has, in my experience, from going to lectures and looking at other surgeons' work, it seems that patients would require more than one fat transfer to the breast, and I don't know if I want to put myself or my patients through multiple procedures to achieve the same result that I can potentially achieve with one surgery with an implant. Now, I understand there's a little movement going around against putting a silicone implant in there, but I really think they're still safe. The last thing that is always in the back of my mind is that with my conversation with multiple radiologists that deal with breast cancer and breast cancer detection, I've heard a lot of opinions about how adding fat to the breast might make it difficult for a radiologist that deals with mammograms and early detection of breast cancer. They've complained that, or they've noted that it might hide or mask or delay the detection of a breast lesion that can be cancerous. So global augmentation of a breast with breast implants, with breast fat transfer is not a procedure that I really want to do. Now, I have done fat transfer to the breast to hide, for example, on the outer edge of an implant, if somebody's really skinny, putting fat from for example, the 9 o'clock to the 12 o'clock, and from the 3 o'clock to the 12 o'clock on the inside of the breast to hide that stuck-on look. I will do that, because that is not really something that is going to confuse a radiologist, because we can put that in the op report and we can define exactly where we put the fat. But when you globally try to enlarge the breast and you're putting it everywhere, I think that can confuse a radiologist. Now, I'm sure that I can have a handful of surgeons screaming and yelling on the other end of this live saying, no, he doesn't know what he's talking about, and I can have another handful supporting me, and I can have a radiologist step up and also support that. I've seen it in our continuing education literature. So at this point, I don't think it's a smart thing to do if there's any chance of masking a breast cancer. So I personally, this is my choice, my opinion, does not reflect on any other surgeon. So if you like what I have to say, then I'm be more than happy to help you. If you don't like what you're hearing and you're more convinced that a fat transfer to the breast is what's the right procedure for you, then you have to seek the help of somebody that does that.
Great. Is Aveli new technology or something that has been around?
The Aveli device is fairly new. I don't think it's older than 2 years. It was in FDA testing, so you know how the FDA works. It takes a long time to approve something. But the concept of reaching a fiber that's causing a dimple and cutting it is not a new concept. It's just the device is very much less traumatic than the technique that I had been using before. It's very difficult to get an instrument that's sharp to a point that's distant, especially if the aesthetic demand does not allow you to make a hole right next to the dimple, right? So, nobody wants a hole in the middle of their butt. Everybody wants the incisions to be hidden. And that's what the Aveli allows us to do. We can be in creases around the buttocks or around the thigh that are inconspicuous, they're hidden, and then we can reach that site, deploy the knife, cut, hide the knife, pull out, and not traumatize all that tissue. So I like it. I think it's a little bit on the expensive side. I understand.
It's worth it though.
But it can be worth it for the right patient. Remember, I'm going to talk about a concept before the question is even asked. If you have a hammer, not everything becomes a nail. You have to understand that cellulite has to be defined. This Aveli only works not on loose skin that's wrinkly, or it's on dimples that do not disappear when you put the skin on tension. So if you see a dimple and you pull up on the skin and it disappears, Aveli is not going to fix that. Okay, Aveli is there to fix dimples that are caused by fibers that are attached to the fascia or to the muscle that are actually causing a dimple that does not disappear when you put the skin on tension. So I hope that helps you guys, but send pictures and we'll let you know.
Great. So the next question we have is, what's the best incision option to minimize visible scars when having a breast augmentation?
I pretty much only go through the inframammary fold. So the inframammary fold, just to make it simple, is where the underwire of your breast, your bra is. So it's the fold under your breast. I think it hides very well. I think if you place it properly and predict where the implant is going to go, you barely get to see it.
So we have J-Lo. Good afternoon, Dr. Garani. Can't wait to come back and see you. You did my surgery.
Hi, how are you? Thanks for jumping on the live. See you soon.
Can I choose to keep some volume in the upper breast pole during breast reduction?
Everybody wants upper pole volume. So the 12 o'clock of the breast is always a goal for either an augmentation or a lift to give you volume there. Gravity is always fighting us, okay? But I try my best to get tissue up there with my breast lift reduction technique, so that you can have the benefit of volume there, sometimes without even using an implant. And you can see from my pictures that I try to compensate for that. I'm aware that the upper pole is always a goal for most women that are going through augmentation and breast reduction lift surgery.
Great. So we have, can I combine chin lipo with a mini facelift or neck lift?
Chin, neck lipo with a mini facelift? Yeah, I think so. I personally don't do facelifts. I haven't dedicated my career to that for a long time now, but I'm sure competent, board certified plastic surgeons or facial plastic surgeons that do a lot of facelifts will not have a problem combining that. But please obviously consult with them.
Of course. Does arm lipo include the underarm or only
No.
the upper arms?
No, it's just the arm, from the joint to the elbow. The underarms is a separate area.
Is cell saver something you would recommend to all
Always.
future patients?
Always. Everybody that gets a lipo should get a cell saver.
Okay. And can you tell us a little bit more about what cell saver is for the
Okay.
people that don't know?
Sure. So cell saver is a technology that's been around for a while. It's been adapted from the cardiothoracic surgeons that do open heart and the orthopedic surgeons that do big surgeries like joint replacements and hip replacements. These surgeries tend to have a large volume of blood loss. So this is a machine. It's a closed system, so the blood that's removed is removed by a sterile technique. It goes into a closed container. It is passed through multiple filters. It is spun. There is different lasers or light that detects different cells that are not viable, impurities, any fat that might have been passed through, and the concentrated red blood cells and some albumin or protein that is in your vasculature is then put in a sterile bag, and that's given back to you. So that helps you with oxygen delivery. So you have your red blood cells, the good ones that are not damaged, come back to you, so you can help you with oxygen delivery. And it's an intravascular volume expander, so you can feel better after surgery. So you have, when you have lipo, there's a shift in fluid. There's a third space, which is where the fat used to be. The body has the cells ooze. So what you want to do is you want to bring as much volume back into the vessels so that your heart can pump adequately. It's, again, I don't want to get too physiologically technical, but it's a very helpful. It doesn't necessarily mean that you're not going to drop your hemoglobin after a liposuction, but that immediate cell saver blood that's given to you, it really helps you in the first 12 to 24 hours. And then you also have to drink, use your GI tract and eat, and you'll feel better.
That's really great. I had lipo 10 months ago, but my belly button is sagging. Do you offer reverse tummy tucks?
Again, be careful what you ask for, okay? Because some of those, yeah, the scars of a reverse tummy tuck are not easy to hide. They're under your bra line, in your arms. So, yeah, well, I mean, when you have liposuction, it's not unusual for the belly button to sort of collapse, because here you go, you gained weight over years, and then in about an hour and a half, 2 hours, a certain amount of fat is removed, and then that belly button that used to be supported by this much fat now has nothing, and it does collapse, and it might fold over. One thing that we do is, definitely recommend sometimes putting cotton in the belly button to tent it up, and a good massage therapist will teach you how to spread the tissue and put foam in the garment. That helps sometimes, but skin stretches, and sometimes when you remove fat, or most of the time when you remove fat so quickly, not everything shrinks back to where you imagined it, where you were 18 or before pregnancy or before weight gain. So to do a reverse tummy tuck just to fix a belly button, is a very long run for a very short slide. I'm not sure if it's the most appropriate thing to do, but again, send your pictures and we can help you with the thought process, because what you read online as the average consumer doesn't necessarily translate into the appropriate surgery. So you choose a board certified plastic surgeon that has experience, that can demonstrate knowledge and give you a logical reason why, for and against.
Amazing, that's an amazing response. My favorite doctor, he did me so good, from TJ Mala Stephanie.
Thank you guys. I really appreciate the support. It's obvious on every live. I get good feedback. I have patients that jump in there just to say thank you. My answer is thank you guys for trusting me. Thanks for listening. Thanks for taking that leap of faith. I really understand that traveling from different parts of the country, near and far, from different parts of the world. We're getting patients from Canada, from Australia, from Europe. Is a sacrifice. It's a leap of faith. It's taking the time to do something. On taking a risk, and I'm very happy to see that the care I give to patients is creating more confidence in the community, and that's the goal, is to give you all that I can based on my knowledge, my experience, as honest and as dedicated as possible, so that it translates into a good outcome that will benefit other patients. So thank you so much for the support. Thanks for jumping in and giving these nice words of support and compliments, because I think that at the end, patients are taking a huge leap of faith to come and trust us with their care just by seeing us online. So I truly appreciate the support from the community. It makes other patients feel better about their decision. Thank you guys, because you've been there before, so you're the proof that I'm doing something right.
Word of mouth is very powerful.
Yes, absolutely, absolutely. I mean, it's hard for patients to make a decision based on just a video. So you have a third party that's out there saying that she or he had a good result is important for me.
Of course. So we have Anissa Guns asking, how much minimum BMI if we will get BBL? Is it possible BBL if my weight is 94? I think 94 lbs and my height is 5'2".
You're 94 pounds and 5'2", so I guess you qualify to be called skinny. But again, send pictures, because you'll be surprised, even at 94 pounds or 95 pounds, you have fat deposits in areas that you might not be happy with, namely the love handles and the lower abdomen. So don't stress about it too much. Send me your pictures and we'll see where you have it, and we'll advise you. I rarely ever ask a patient to gain weight. I'm kind of against that. Go ahead.
So Crystal Beauty is asking, when getting arm lipo, does the size of the arm matter?
It's not about the size of the arm. It's about having fat there, and the quality of the skin, and what I think is going to happen with the skin after I remove the fat. You might end up needing a skin removal procedure called a brachioplasty or an arm lift. In the meantime, just real quick, if you're on the border between having liposuction and needing an arm lift, it's very smart to use J-plasma, because I feel like J-plasma has proven itself to me by using it on different patients. It is stimulating the skin to shrink, and then the collagen to regenerate. We might escape and not have the patient convert to a arm lift, because the arm lift scar can be visible. It's on the inside of the arm. As best as I try to hide it, it's not the easiest scar to hide. Certain patients have gone beyond the point where we can salvage the arm with just lipo and J-plasma, and I try to tell them that from the get-go. But with the advent of J-plasma, it has helped me not have to go into that direction.
And it retaps the skin by up to 60%, you guys.
Yeah.
So, can you do a BBL after previous butt implants or fillers? What if somebody...
If the filler is permanent, it makes it more dangerous, because the filler is an inert material. It does not integrate with your fat. So patients that have had fillers that are permanent, that means methyl methacrylate and silicone and so forth. Let's not even get into the different brand names, but those fillers can interfere with the placement of my fat, and also can can cause an infection, because usually these fillers that are permanent are in a state of constant inflammation, and the patient, if I enter that area, it's like entering into basically a very hostile territory, and you can get an infection of the fresh fat that you're putting around. Now, if there are areas that are clean and distant away from the fillers, and I can see that on a CAT scan, so I need a CT scan of the buttocks area that can help me localize where the fat is, and I actually need the films. I need to see the actual films either on a CD or on a thumb drive. I don't, I'll be more than happy to read the report, but I need the images, because I myself can read the CT scan and know that if I can help you. So before you jump on board, if you have permanent fillers or a gel implant, please do a CT scan. Let me see where everything is. Have I done cases where there is permanent filler? Yes. In some cases, I was shocked and surprised that the patient didn't tell me. I can figure it out as soon as I put the ultrasound on there that there is foreign material, and we stay away from it. We just add fat to the areas that are virgin fat that does not have permanent filler. So again, first tell me the truth. Second, get me a CT scan. If it's a filler that's not permanent, like Juvederm, hyaluronic acid, which is Juvederm, Sculptra, any other non-permanent filler, usually it's not a problem. Okay, we're always going to ask you for a CT scan, because a lot of patients have told me, oh, but it wasn't permanent, and lo and behold, yes, it was. Where did you do it? Oh, I went to a hotel, or I went to somebody's house, which is kind of scary, but it happens. Again, no judgment here, but I'm not going to do something that's going to compromise you, especially if it's an aesthetic procedure and an elective procedure. This is nothing that we need, this is something we want. So safety first, as much information as possible before we go into something that can harm you, okay? And then in reverse, in return, cause me a lot of stress. Thank you.
So we have Toy Son. You guys, we only have a couple of questions left, okay? Dr. Gurani does have to go, so if you want to ask your question, this will be the time right now to do so, okay? So Toy Son is asking, do you do Lipo 360 and tummy tuck together?
Okay, so this concept is giving me a lot of stress and angst, because it's being pushed so much on patients by the social media engine, okay? Guys, yes, there is a certain amount of lipo that can safely be done with a tummy tuck, okay? Now, if you want this high definition Gurani lipo, I don't necessarily recommend that you go for a tummy tuck, because that's the aggressive lipo. I need all the blood supply. I don't want you to have compromised skin just because you want to just get it done, okay? When patients have come to me that just want to get it done, they're either not happy with their tummy tuck or they're not happy with their lipo. Now, within a certain BMI, a certain amount of fat content, it is appropriate. I've done a bunch of augmentations with 360 lipo. That's a very appropriate procedure. But again, the amount of lipo is limited as per the rules of the Department of Health. We go from 4 liters to 1 liter. Okay, so just think about it. You might say, yeah, no, I mean, I don't need a lot of fat, but let me tell you something. It's very surprising how a lot of patients that are quote unquote in shape, and I can still get 4 liters out of them, and they look amazing. So you have to be careful. And I know, again, a lot of surgeons are online promoting this, but there's a selection process. You have to be the right patient for it, okay? Again, I do things based on evidence-based medicine. I do things based on also honesty. If the aggressive lipo that I do combined with the tummy tuck is not going to give you a good outcome, I'm not going to let you have it. If it's reasonable, I will do it. Now, it's all about blood supply and good outcomes. I will not combine a BBL with anything.
Oh, yeah.
Forget about it. It's not worth it to me. I think it's dangerous. I've heard it from different surgeons that do it themselves, that it's not the ideal situation because you favor something. You either favor your belly, or you favor your breast, or you favor your buttocks, and something gives. So why? You know? And when it comes to, you know, the liposuction, you know, I think, you know, if you're very close to your ideal weight and we have problem areas like the love handles, a little bit of bra roll, you know, yes, it makes sense. But you know, if you're overweight and you have loose skin, you know, trying to just hit two birds with one stone, you might not get any birds. You're gonna fall flat on your face and have complications.
That's
So
perfect.
I personally, I'm very cautious with that combination. You know, the mommy makeover with a lot of lipo, and you know, like I said earlier, I'm gonna get criticized by a bunch of surgeons. I don't care. I really don't care what they think. I only care about the well-being of my patient. So there's no cookie cutter here. You have to choose the right patient. So be patient. Don't get offended if you're not a candidate. I'm very picky with my criteria.
So you guys, we have just 2 more questions and then Dr. Garani has to go. You guys, I see you guys are asking lots of questions.
Go ahead.
You know,
I'll give you guys a little bit more, like 5 minutes.
5 more
and then
minutes?
we'll
Okay,
do-
great, you guys. You see how amazing Dr. Garani is, you guys. Can a skinny BBL still create projection if the patient is very lean?
Yes.
Yeah.
Yes. It's about where you take it out from and how you strategically place it. You know, it does not have to be large volume lipo or large volume transfer to make you look good. It's based on your body habitus, it's based on your proportions. So that's why you need an experienced surgeon. I have done a lot of patients that are actually fit, and if you know, they have stubborn areas of fat, and we're talking about 1,000 cc's can really make a difference on your torso. And then if that's all I have to transfer to the buttocks, if it's placed strategically, you will look nice. It'll make a difference, and you'll look elegant.
So, Kali Kimari, I see that you asked this question again, love, about should I gain more weight before BBL? You shouldn't gain more weight before BBL.
Not for
Dr.
me.
Garani, yeah, was actually going over that, you guys, because he is rarely ever gonna ask you to gain weight for a BBL. Okay?
I maybe can think of maybe one patient in my whole career that I did that. Send me your pictures. There's places to find fat. Your lower abdomen, your love handles, your bra roll, inner thighs. There's always some fat that we can use.
So we have Dominican A Fly 88. We have to do thigh lipo for a second round mandatory. I believe she got a second round and she's
Okay, guys,
wondering about
this
thigh
whole
lipo.
thing about mandatory. Okay, listen, you're getting a cosmetic procedure. You're getting high-end lipo. You're getting an experienced surgeon. So don't try to cut corners. When somebody's recommending inner thighs, it's because you've been done before. The areas that we usually go for are either being cleaned out so much, or fibrotic, or there's not enough good fat there for me to go for. So that when I suggest inner thighs or underarms or arms, it's because I know that from the pictures, the first case did not go there. So I'm trying to go there for sources of good fat that I can use to fix your hips and your buttocks. The rest of the body will still get lipo to fix irregularities, to remove some fat, but fat from areas that have been scarred and traumatized before is not as good of quality as fat from virgin areas. Okay, so that's the reason I do it. You want high-end lipo, then you're more welcome to my practice. You want other types of lipo, then you want the cheaper surgeries, go somewhere else.
Yeah, and cheap is not always better. I'll tell you that much, you guys. Like you pay for what you get, really. So. We have here, that's so tatty. I am U.S. Army veteran and I love my body. Everyone compliments how natural I look. When I tell them I had a surgery, LOL, they don't believe me. I am so happy to hear that. She's really happy with you.
Thank you. Happy to help everybody, especially our veterans. Thank you for your service.
Oh, that's so sweet. So, one of the last questions that we have is, can J plasma be done without liposuction for loose skin?
No. So it's very simple. The J plasma instrument has to go through the same tracks that I create doing the lipo. it's not possible for me just to do J-plasma without a certain amount of lipo. So it's a combination.
So
one more question and then I'm out.
One more question and then he's out, you guys. We have a comment here and then we're gonna go to the question. From TJMO Stephanie, I love my doctor. He keeps it so real. This is why I look the way that I do. Just look at my page. Thank you.
Thanks for your support. What you see is what you get. I don't quote it. I don't cover this up with honey.
And we are super, grateful that you get on this live and you allow, other future patients to be able to go to your page and see, your results. Thank you so much for your comment. Okay, so here we have another question. What do you think about extra high profile 495cc? And then we have another comment, the best surgeon hands down.
Thank you. The 495cc is not a bad implant. The extra full is the Allergan natural implant. I like them. I pretty much use them all the time. But 495 or 310, 400, guys, it's hard for us to just say it online without a patient. I like to measure the distance from your sternal notch to the nipple, the distance from the nipple to the fold, the base of your breast. That means from the middle of the chest to the side, to see how much tissue I have, how wide is your chest wall, how much tissue coverage I can put on the implant, how much tissue you're giving me. So there's a lot of factors going on in my brain when I am trying to determine the right implant for you. So the number 495 does not matter to me. The actual CCs does not. What matters to me is how much, what your skin is going to behave like. Have you had a pregnancy? Have you gained and lost weight? Where the position of your nipple is? Is it a pure augmentation, or do I need a lift to adjust the position of your nipple? Different concept. Are you giving me some volume, or I need to give you a lot more volume because you don't have a lot of breast tissue? So all these factors weigh into my decision on what implant I try to pick for you. I will listen to you. If you come in with a number in your head because somebody told you get a 350 or a 355, but the idea is I look at the base width, I look at the distance of where the nipple is on your chest wall and where the nipple is with respect to your breast mount, and that's how I choose the implant so that it gives you the best result possible. And I will listen to you if you want to be a little bit more, on the showy side or on the in the middle or on the conservative side. I will listen to you and we'll try to see whether an extra full or a moderate is the right one for you. Because for the same volume, we can get different base diameters, different heights, and it has to really be tailored to you. That's the idea that I've tried to put out there, whether it's a breast or a lift or a tummy tuck or a combo procedure or whatever, it's tailored to you. It's my experience based on thousands of patients that have allowed me the privilege of operating on them, and based on my fund of knowledge from residency and training and wound healing and blood supply, mixed with experience of thousands of patients, gives me to the point to be able to have a critical eye and give you the appropriate combination of procedures or techniques that gets you to where you want. And that's why you have to choose somebody that's comfortable with what they're saying. They can answer these questions without rehearsal. This is a live. I have not heard these questions before. This is just my experience and my knowledge coming through on this live. So, board certified plastic surgeon that knows what they're doing, and they can prove their work by either the patient recommendations, word of mouth, pictures, or an in-person consultation or a virtual consultation. Whatever we can do to help you understand is what I'm trying to do here. So thank you so much for the support from my previous patients. I appreciate that. That talks volumes more than any picture I can put up there. Thank you so much, guys.
Thank you guys so much for this live today. Thank you so much, doctor.
Thank you for
your time. So he doesn't get the nickname Dr. Go for no reason, you guys, and you can clear as day see that. Okay, you guys, thank you guys so much. Have an amazing rest of your day, and we'll see you back very soon.
Okay,
Bye.
have a good weekend. Bye.